Hello and welcome to all of our Gold viewers who are here with us today. I'm Kirsten Schwartz, licensed midwife and MC here at Gold. And here at Gold, we're busy. We are getting really busy with the GOLD Lactation Online Conference that's just around the corner here. And we're also producing a lecture add-on pack for this presentation, for this conference. And with me here today is Dr. Kirsten Hannan. Welcome, Kirsten. Good to have you here.
Thank you for having me.
You are, of course, one of the speakers of the add-on package, a whole body approach to the clinical management of complex breastfeeding issues. It's a whole wonderful lecture pack that we're specifically creating this year here. But before we dive into the lecture pack and your presentation, of course, first of all, where in the world are you, Kirsten?
So I'm in Sydney in Australia.
Beautiful. So that's one thing I really enjoy here at Gold, that we could be anywhere in the world and we can learn together and learn from each other and from international speakers with an international audience. For me, that'll never get old. I always love that concept of the international conference, that we all are together in this passionate professionals in this field here of the field of lactation, right?
Yeah, it's amazing actually to be able to speak to such a wide audience and have so much experience that we can access at our fingertips.
Wonderful. So Kirsten, let me ask you a little bit about your professional background. You're an osteopath and also an IBCLC. So tell me a little bit about your professional journey.
So I first started out on my journey as an osteopath. After I left school, I went straight to university to do my osteopathy degree. And I'd always been interested in the health sciences and the human body. So that seemed to be a natural extension for me. And once I graduated, I'd also been always around children. I used to nanny and I'd always enjoyed that contact. And so after I graduated and had the opportunity to start working around children, that was what then piqued my interest around breastfeeding and the support of the mother-baby dyad. And I then started to embark on my IBCLC pathway and that journey.
Wonderful. Thank you for telling us a little bit about your background here. To clarify, can you tell us what is an osteopath for our viewers who might not be familiar with that? Maybe it's called something, maybe that, it's not that familiar in their country. Just explain to it a little bit what an osteopath does.
Yeah, so an osteopath is essentially a manual therapist, or we fall under that umbrella of manual therapy or body work. So that means that we provide hands-on diagnosis and treatment. And essentially, we're probably best known for our treatment of musculoskeletal conditions, so things like neck pain, shoulder pain, back pain. But then there's a whole area of osteopathy that focuses on our pediatric population. And ultimately, what we influence is a lot more than muscles and bones as well. So it does involve hands-on diagnosis and treatment, but also it involves looking at posture, exercise, movement advice, and looking at the person as a whole person in the context of their environment and why they happen to be having pain or their problem where they have it at that time.
Sounds wonderful because, you're so right. You're looking at the whole person, because when it comes now to, of course, breast and chest feeding and lactation, the baby is not just a mouth, right?
Exactly.
So much more to it, and, how the baby is born, if it came down a little asynchronically. As a midwife, I'm always looking at that. What that can do to the baby, and all that, of course, has implications on breast and chest feeding, correct?
Absolutely. It has a huge impact. And often when I'm looking at babies and, I have them on the treatment table in front of me, or I'm looking at how they're lying on mum or interacting with mum, in my head, I often have that visual of what I know about their birth history and the pregnancy history and what I can see in front of me and how those things have interacted, to an impact on that baby. And it can be hugely impactful how that baby is born. And as you said, if they're asynclitic or if they happen to be posterior and they've gone through a different series of movements to what might be normal or more common, it can absolutely affect their structure. And when we affect that, it affects function. It has an enormous impact on breastfeeding.
So when you work with these little ones, you mentioned manual therapy. I can only imagine it must be very gentle, of course, right? Would that
Absolutely.
how can I envision that? Does that look like a massage or just like can you explain it a little bit for us?
Yeah, so some techniques might look a little bit like a massage, but it's very different to treating adults. They're not just little adults or little people. Their
Right.
structure is entirely different, and so it involves a very different approach. What we're often looking at is what is the movement in different areas, and I tend to approach it from the toe all the way up to the head. So really looking at alignment of the legs and feet, the movement of the hips, and we're really gently taking all of those joints through their range of movement to see how those joints are actually functioning, how the baby responds to those movements as well. Do they see comfortable or at ease, or are they resisting those movements? Sometimes when they're lying in front of you, you can see that they naturally want to tilt their body to one side. They're quite skewed. Sometimes I refer to them as little banana benders, or where they've got these little postural tendencies that show that they're much more comfortable in one position than another. And once we have that information from the hands-on assessment, we often will then turn those things into gentle treatment approaches. And sometimes that can be massage techniques. It can be a little bit, really gentle joint movement techniques. I also work with cranial osteopathy, which is a branch of osteopathy that involves really indirect gentle pressures that are working with that particular body mechanism. So it is a really gentle technique. Sometimes, some patients say, oh, what's happening there? What are you doing? Because it's really subtle, but then they can see how the baby responds to those subtle movements. So even sometimes just applying gentle pressure in certain areas to release tight structures or release muscles, all of a sudden you see that baby who hasn't been comfortable laying their legs out flat or hasn't been comfortable turning their head in one direction suddenly can move into that direction with more ease.
That's fascinating. And I can imagine you also looking at reflexes probably as well, right?
Definitely. Yeah, that's right. So looking at all of those innate newborn reflexes and how they're expressed in babies. And when we have some of these underlying sort of postural issues that happen, it will often impact the expression of those reflexes too. So that also gives us information as to how that baby is functioning and how well their whole body has integrated after their birth experience, and how that can then impact on their feeding.
Absolutely. And what about the diet? Also, are you also looking at the parent, the mother? I can imagine if there's somebody with maybe scoliosis or something that, also then putting the baby on might be different and maybe awkward, or, you know what I'm saying? So that the baby might not get the best latch or something like that. Or how will that work if you work together?
Yeah, absolutely. So of course, breastfeeding, chest feeding, it's a mother-baby experience. And so what's happening for that mum is also relevant. And when we're looking at positions, the position has to be comfortable for the mum. And there may be reasons why certain positions just don't work for her. And it could be to do with her underlying structure, things that, as you say, like scoliosis. It could be to do with breast symmetry, breast fall, all of those sorts of things that we have to look at as well. And ultimately, if she's not comfortable in a position, she's not going to be able to sustain that position. So it's not going to work. So even if it looks amazing, if it feels wonderful, if she can only do it for 2 minutes, then it's ultimately not going to be successful at all. And so that's why I think treating them as a dyad and looking at what's happening for mum as well is really important. And I find that when we're looking at the breast and the function of the breast, looking at it in the context of where it sits, what it's attached to, how it's influenced by neck and shoulder posture, how it's influenced by breathing mechanisms, all of those things are then relevant to the breastfeeding success.
Sounds great. Now let's talk about the presentation here, the role of manual therapy in infant postural asymmetry, suck dysfunction, and mastitis. So tell us a little bit what we can look forward to learning in that presentation.
So what I'm looking forward to sharing is initially really about all of the underlying anatomy that we're looking at that inform clinical practice as such. So then looking at the anatomy of the breast, the anatomy of infant suck and infant postural asymmetry, and then applying that to how we can then address any dysfunction that we happen to find and how that can then influence breastfeeding success as well.
Beautiful. Can't wait for it. Looking forward to this presentation very much. Now, any final words, a little nugget of wisdom here before I let you go, Kirsten?
Oh, that's a very, very good question. I think ultimately one of my goals in terms of giving these presentations and being part of the education around breastfeeding is to try and set mums and babies up for success as much as possible, and try and make sure that the information that they're getting is really based on evidence and really, you know, grounded in the science, so that they're getting consistent information as well. I think one of the probably two of the most common questions I would get is this normal? So I think that's a very big one for mums and babies. So it's really helpful to be able to frame things in terms of, well, what is normal and what falls outside of normal, and then how we can help. And also then looking at, well, what can we do to help this? Is this something that has a solution? And very often, you know, it does. So if we can help to provide that information for everybody so it's accessible, then we can help more mums and babies achieve their breastfeeding goals.
Evidence-based information, and that's so important. Absolutely. Well, thank you so much, Kirsten Hannan here, for being here with me today, chatting about the wonderful work you do and also about this presentation. I'm very much looking forward to it.
Me too.
And to our viewers now, if you would like to find out more about this presentation and the whole lecture pack, which is titled The Whole Body Approach to the Clinical Management of Complex Breastfeeding Issues, we invite you to go to goldlactation.com. There you will also find information about the upcoming GOLD Lactation Online Conference 2023. And we get started with that conference on April 3rd with our opening keynote presentation that is absolutely free and open access to everyone. So make sure you sign up for the keynote presentation. I hope to see you at the conference and at the lecture pack as well. Thank you, everyone. Bye-bye.
Bye.